Hi everyone, very good morning guys. I hope I'm audible and visible to all of you. Can I get a quick confirmation in the chat box so that we can start with the session? And very good morning. After a long time, we are having a morning session. So I hope all of you are doing well, and I hope all of you are preparing well for the upcoming exam. So we're gonna have a very short session, less than 10 questions, and the point is to keep it short, simple, and also to just give you a confidence boost somewhere midway in your preparation. So without any delay, I think we'll start. I plan to wrap it up in 20 minutes. It's a super fast session which we're gonna have, and I hope that will give you like a kickstart for the rest of your day. Let's get going, guys. Let's start with the very first question that I've got. And obviously, I've picked up questions since the earliest exam that we have coming up is the FMG July 30th exam 2023. So that is the PYQs that I've picked up are maximally from the FMG paper. So the first question that I have to start is, of course, going to be the one that has been asked maximum number of times. It's almost an alternate year repeat, and that is tumor markers. So this table becomes very, very important. CA 199 is a tumor marker for, if you had to select only one answer, everyone has given me pancreatic cancer, but what if you had multiple answers, A, B, B, C, C, D? If this was the kind of the situation and you had an option of selecting two, then you could have also selected colon cancer. That is what I want to tell you as a controversy, that when you're dealing with CA 99, primarily you flip the 9, देखो 9 को flip करा, you get a P. So primarily it is pancreatic cancer, but it can also be elevated in colon cancer. So ये ध्यान रखना कि if only one is asked, I will mark B. If two are asked, then it is also pancreatic and colon. What about the other tumor markers? These are the ones which are the most important. So let's proceed. Beta HCG, I think everyone knows. Firstly, always the beta subunit is measured, alpha subunit is never ever measured, and we all know this is for a very famous tumor called choriocarcinoma. So I think this in a gynae question is very, very important. Okay, calcitonin. This is a surgery question. Calcitonin is released from the thyroid. So obviously a tumor of the thyroid is going to be important, and that is medullary carcinoma thyroid. Okay, coming to the next one. Alpha fetoprotein. Alpha feto. This feto, it comes from the fetus, means it comes from the yolk sac. So number one, it's going to be yolk sac tumor. Then there are going to be two tumors of the liver. One is liver tumor, that is hepatocellular carcinoma. One is a bachcho wala liver tumor, and that is going to be hepatoblastoma. So these are the three things, and you know that alpha fetoprotein, very, very important. Yolk sac, HCC, hepatoblastoma. Very good. CEA, carcinoembryonic antigen, C for C. CEA is elevated in colon cancer. This is again a very famous surgery question that you have. Let's move on to the next. All the CA numbers that you have for the exam, guys. CA 19.9 so we have done. 9 ko flip kara, you will get a P, that is settled. CA 15.3, what will you do? To the 3 over here, you can make it into a B. So CA 15.3 is going to be for breast cancer, and CA 125, the one which is most important in gynae, is going to be for ovarian tumors. So now my question to you is, which kind of ovarian tumor, which family of ovarian tumors? Surface epithelial, या फिर germ cell tumors, या metastatic tumors? Please remember, it is important for the surface epithelial tumors. Surface epithelial tumors. Settled. So these are the most important tumor markers that you have to know for the exam. Out of it, CA 19.9 is a regular visitor. It is going to come again and again. This was a quick first question. Let's move on to two questions more, which are all based on your favorite granuloma. So question number one on granuloma, you need to tell me that there is a picture image based question, and you need to tell me which of the following diseases is it associated with. So when I'm talking about granulomas, I can see a beautiful star being made over here, and this star means I'm dealing with a stellate granuloma. Yes, everyone agrees with me, and we've got answers. Stellate granuloma is a feature that you see in number one, cats. Keep telling me organisms also, not just disease. Cat has scratch, fine. Cat scratch disease में दिखता है. Lymphogranuloma venereum में भी दिखता है. So the answer over here becomes option C, correct. But what are the organisms? So cat scratch disease is caused by a famous organism called Bartonella Hensley, number one, and lymphogranuloma venereum is caused by Chlamydia trachomatis. कौन सा वाला Chlamydia trachomatis? Is it Chlamydia trachomatis A, B, C, D, L, P, Q, R, S? कौन सा वाला? So ma'am, L for lymphogranuloma venereum, L for L1, L2, L3. Chlamydia trachomatis L1, L2, L3 cause lymphogranuloma venereum, and cat scratch disease by Bartonella Hensley दोनों में ऐसा star shaped granuloma दिखेगा, stellate granuloma. Moving on to the next question, very simple. What is the granuloma that has been shown? I've given you a nice picture also. I've given you the hint. This is looking exactly like a donut. So of course we will call it a donut granuloma. Sirf we have to know what are the causes of it. So now I can see a very tempting option over here. All of the above. All of the above likha hai doesn't mean it will always be the answer. I start reading. Cat scratch disease? Nahi. Cat scratch disease was showing me stellate granuloma. Lymphogranuloma venereum was also showing me stellate granuloma. So over here, all of the above to answer बिल्कुल नहीं हो सकता. The correct answer is Q fever, exactly. So how do we learn it? From this donut, if you make a line, you end up getting Q fever. And what is the organism for Q fever that you study in microbiology? The organism is going to be Coxiella burnetii. Which family? Which family does it belong to? Coxiella is a kind of a member of a Rickettsia family. That is what you study in microbiology ना. तो Rickettsia family का एक बहुत famous rule है that the Rickettsia family is going to have a tick bite or a lice का bite या mite का bite, some kind of vector bite, tick, mite, lice, कोई तो bite होगा. But Coxiella is different. Coxiella is the one which is not going to have any kind of bite. It has no vector. So ma'am, how does it spread? It has a very common spread by inhalation. It has nothing to do with some bite of any vector. It is inhalation. तो अब common sense है, जब कोई bite ही नहीं होगा तो कोई rash भी नहीं होगा. So there is no rash that you see with Coxiella. So please remember all the Rickettsia family members, tick bite, mite ka bite, lice bite, all of them have a vector. Vector hoga, rash hoga. In Coxiella, no vector, no rash. It is gonna spread by inhalation and it causes a fever called Q fever. Okay, for FMG students, that is where the story ends. For NEET PG students, one more cause. One more cause of donut granuloma is going to be a drug which was asked in your AIMS 2011, and that is allopurinol. Allopurinol drug can also cause donut granuloma. These two questions are settled. Very good. Let's move on to the next question. I've got you two questions on the same theme. So first I want you to answer this first question. Here you've got an elderly 70-year-old woman who's come to you with throbbing unilateral headache and vision problems with weight loss, mandibular pain. The patient also has bouts of fever, malaise, muscle aches. There's enlargement of temporal artery with pain on palpation. Biopsy shows giant cells. Ma'am, if I could write an essay on giant cell arteritis, this is how the essay on giant cell arteritis would have looked like. It's actually like writing an entire description of the disease. That is why I say lengthy questions are always is welcomed. You should never run away from lengthy questions. You should welcome lengthy questions, because the more I will talk, the more information I will give you. The more examiner will talk, the more information he will give us. As it is, as simple as that. So ये वाला question we will discuss. But एक और question on the same theme, same options guys. Options remain the same, and now the question changes. What is your answer to this one? And then I'll start with, I want to teach you these disorders, so I'll teach them to you eventually. So this is becoming very, very simple. So we realize that ये जो vasculitis वाले questions है, they are the easiest to solve because examiner is going to talk a lot in them. So over here, you've got double vision, fainting spells, tingling of fingers of the left hand, and there is numbness in right hand. You will realize all upper limb kind of features are happening. Absence of pulse in her right arm. I don't think we need to read beyond. Pulseless disease. Pulseless disease has to be Takayasu. But what has been affected over here? Ma'am, even further affected right subclavian artery. Pakka hi Takayasu disease hai. So these are the two diseases which I want all of you should mug up as it is, because in pe to definitely a question is going to come. So everyone, first, what family of vasculitis is it? जो दोनों T's हैं, the T and the T, they are large vessel vasculitis, right? So सबसे पहले large vessel में we have T for temporal arteritis. तो common sense कौन सा वाला artery effect होगा? We are going to have the superficial temporal artery that is going to be affected. And if superficial temporal artery is affected, so unilateral headache, extreme throbbing headache will be the most common symptom. That is the most common symptom. Please tell me which is the most specific symptom. That is the one that is going to be very, very specific, and that is pain in the jaw, or jaw pain is also referred to as jaw claudication. So mandibular pain, jaw pain, वो specific symptom है. Common वाला is headache, specific वाला is jaw, but which is going to be the most dangerous? If that happens, I am very, very worried. Which is the most dangerous symptom? Alert. Alert वाला symptom कौन सा है? Loss of vision. So loss of vision is what I am very scared of. That is why, tell me one thing. If you are suspecting a case of giant cell arteritis, do you wait for the pathologist report, or do you start steroids stat? We have to start with steroids as soon as possible. Why do I say that? Because loss of vision हमें नहीं कराना. I am very scared of this dangerous thing. तो stat steroid start होगा. So vessel you have done, symptoms you have done. I don't want to tell you microscopically because common cells है. Microscopically I can see giant cells. तो of course giant cell granuloma दिखेगा. What is the age? Please remember, giant cell occurs also in giants. Giants में होगा, मतलब it is the most common vasculitis that occurs in adults. It is going to occur above the age of 50 years. Come back to your question. Was your patient above the age of 50 years? Yes. Was she having a unilateral headache? मतलब temporal artery affect हुआ. Was she having jaw pain? Specific symptom. Vision problem? Dangerous symptom. Temporal artery effect हुआ. Giant cells are seen. Each and every word was for giant cell arteritis. So the first one is settled. Now let's move to the second one. Takayasu. Takayasu is known as aortoarteritis. When I say aortoarteritis, I can see that yes, the arch of aorta is affected. Can you see this over here? Arch of aorta is affected and the vessels are getting narrowed. You can see narrowing of the vessels out here, and you will realize that the most common artery affected is the subclavian artery, and that was also given in the question. In short, जो upper limb को जा रहा है, whatever is going to the upper limb is getting affected. तो upper limb में pulse will get affected. The upper limb pulse is going to be very, very weak, and that is what you see in Takayasu arteritis. Age क्या होगा? This one is gonna be less than 50 years. So simple. Giant cell arteritis was giants में above 50 years. Takayasu below 50 years. Come back to your question. You will realize all upper limb features and absence of pulse in the upper limb with subclavian artery involvement has to be a case of Takayasu. These two T's are very important in the exam. In pe ek question FMGE exam every year is having, so you have to know the two T's. Are we okay with this? Let's move on to the next question. Which H. pylori protein is associated with the role in the development of gastric neoplasia? Again, very, very important. This question is for FMG and for NEET. I'll tell you the variation. H. pylori pehle to bata do answer. Which is the one? How does H. pylori cause cancers? Answer is CAG-A. So guys, first listen to questions which are applicable to all exams. When you're talking about Helicobacter pylori का microbiome से start करते हैं. What is it? Tell me the characteristics. Catalase क्या है, oxidase क्या है, urease क्या है, positive है, negative है. So what is this going to be? So this is going to be, the people call it COPS. I like to call it COOPS. Why? Because this is going to be a catalase positive, oxidase positive, urease positive. So you can see that these are so many positivity. So it is catalase positive, oxidase positive, urease positive, and it is a spiral shaped organism. So I think everyone will remember Helicobacter pylori is this in terms of microbiology. Okay. I want to look at Helicobacter pylori. What is this black color stain that I have used? There's a very famous stain called WSSS. WSSS matlab there is Warthin Starry Silver Stain. Warthin Starry Silver Stain for H. pylori. And guys, my rule says that wherever the word silver is going to be used, I am going to definitely get a black color. The black color is because of silver. I have said that. Now you would ask me, what does H. pylori cause? What are the two cancers? So God has given H. pylori these two magic, these magical elements. God has given it something called CAG-A and VAC-A. ये दोनों चीजें God gifted है. H. pylori has them because via this it is going to cause two cancers. What are the two cancers? H. pylori stomach का ही cancer कराएगा. One is going to be stomach adenocarcinoma and one is going to be stomach lymphoma, and that lymphoma is going to be maltoma. So repeating once again, what is the thing that God has given it? CAG-A and VAC-A. So this is something someone said GIST. No, GIST is not caused by H. pylori. GIST is caused by a mutation. GIST is also a stomach tumor, but GIST is caused by c-KIT or CD117 mutation. GIST is not associated with H. pylori. H. pylori के साथ adenocarcinoma stomach, lymphoma, maltoma या lymphoma वाला stomach. Someone said leather bottle appearance. No, leather bottle appearance is, I'll give you a separate one. देखो, when I say stomach cancer, like over here I said stomach cancer, na? So there are two varieties of adenocarcinoma stomach that you need to understand. This is what you study in surgery also. दो टाइप का स्टमक कैंसर होता है. वन इज गोइंग टू बी जिसमें यू विल सी दी ऐसा ग्लैंड्स, यू विल सी प्रॉपर ग्लैंड्स, एंड दैट इज नोन एज intestinal type of stomach cancer. That is the one that is going to be caused by H. pylori. That is frequently caused by H. pylori. The second one is, मैम कोई gland नहीं बना, अलग अलग अलग, separate cell. Diffuse gastric cancer. Diffuse gastric cancer is usually not associated with H. pylori. Diffuse gastric cancer is a genetic mutation. This is also important. और ये diffuse gastric cancer है, which is Linitis plastica. Someone asked me, ma'am, what is that leather bottle appearance that you have? This is Linitis plastica. This is usually not associated with H. pylori. This is because of a mutation, and that is E-cadherin mutation. This is loss of E-cadherin that you all have to know. याद आ गया? Very good. चलो, coming back, we are settled. So अच्छा, why did this cancer happen? Cancer happened because of CAG-A and VAC-A, and now we are settled. अच्छा, this is for all exams. एक extra, very extra edge question for students who are targeting INICET is, what is the virus which is causing SRC mutation? SRC mutation is associated with Epstein-Barr virus. One ratta question that you will have to do only for INICET, it is important. SRC is a proto-oncogene mutation that Epstein-Barr virus is going to do. Other than that, it is not important for any other exam. Dr. Naveed, it's very simple. Acha, tell me one thing. Like someone had said, ma'am, ये वाला slide दोबारा बता दो. While I tell this slide, others have to answer for me that ये जो अभी मैंने पूरा story बताया, what is this fancy classification known as? Because surgery में all these fancy classifications are asked. Till the time everyone answers the name of this classification, Dr. Naveed, please note, दो टाइप के stomach cancer होते हैं. एक में ऐसा gland बनता है, that is known as intestinal type, that is caused by H. pylori. एक में ग्लैंड नहीं बनता, there is no gland formation, single cell, that is diffuse gastric type, that is because of which genetic mutation? That is because of loss of E-cadherin, and उसमें you see the leather bottle appearance. तो ये बिल्कुल अलग टाइप का कैंसर है, म्यूटेशन से होता है, leather bottle appearance. This is not usually associated with H. pylori. Meanwhile, I've got a right answer. This classification that I just taught you is known as a Lawrence classification. Although people say कि surgery का बड़ा important question है, but ये pathology का question है. I will be little possessive about it. Why? Why am I being possessive? Because look at the classification as में surgery का तो कोई aspect ही नहीं है. Whether it looks intestinal type or diffuse type, this तो a pathologist's report will tell. So I am being a little possessive कि ये surgery का question है, ये patho का question है. Okay, so this is also done. I'm done with this super complicated slide. Simple H. pylori and everything that you had to know about it. Let's move on to another question, which is an all-time favorite. So here you have, they've asked you what is the characteristic histopathology finding that you see in Whipple's disease. I can switch this around because yeah, now it must be visible. Characteristic histopathology finding in Whipple's. I've always told you, you have to learn that one word or one sentence which is very very simple. Yes, I've got the answers, and that is there. Meanwhile, a small little appreciation from Dr. Anshu, so thank you so much for coming in and just sharing your appreciation. It really means a lot. Thank you. Okay, so yes, what about Whipple's disease? D answer unanimous, सबको पता है. अच्छा, D answer तो पता लग गया. Can I look at? I'll come to that. पहले बाकी सब क्या था? See, mononuclear infiltration. This is a very vague thing. कुछ भी लिख दिया है. They've written shortened, thickened villi with increased crypt depth. And what is this blunting of villi? ये जब whenever they are saying कि villi flat हो गए, villi have been flattened instead of being like this, villi have become flat. Which disease are they trying to tell me? They are trying to tell me some disease. मैम ऐसे तो villi था, but now the villi have basically undergone flattening, blunting. ये वाला कौन सा disease है? ऐसा कैसे हो सकता है? Some antibodies must have come. Some antibodies must have come. They must have done an attack on these villi, and तभी the villi have gone flat. That is seen with that gluten wala disease. Exactly. The celiac or the gluten disease, when you all know na, people are sensitive to gluten sensitivity. That is when antibodies are formed. That is why villi will go flat. So villus कभी भी flat लिखा हो, that is a problem in gluten, not in Whipple's. Whipple's में क्या होता है? Everyone learn with me. Word number 1, word number 2, word number 3. As it is, याद करो. When I am talking about Whipple's disease, firstly, why do you call it Whipple's? Question number 1 of the exam. Ma'am, it is an infection. It is caused by Tropherema whipplei. It is caused by Tropherema whipplei, and this is a gram-positive organism. As soon as some organism will come into my body, I will eat it. Which is the cell which is going to eat it? It is always going to be macrophage. So how will I identify? For the diagnosis, I will have to look at macrophages. Those macrophages which have eaten up this organism. कैसे देखेंगे? They will be PAS positive. And in which layer of the intestine will you see it? You will see it in lamina propria. Guys, for Whipple's disease, as I don't say कि ये रट लो, I say ये alphabet by alphabet रट लो. Even one alphabet, one dot, one dash, you cannot change. इसे as it is याद रखना है. Every word is important. Which is the stain that you use? PAS. What is the cell that you see? Macrophage. Which layer that you see it in? You see it in the lamina propria. Now tell me something. PAS gives what color, ma'am? P for PAS, P for pink. So PAS will all these pink color collections that you're seeing out here in the lamina propria. This is all PAS positivity, macrophages, lamina propria. All three words are fitting in over here. Someone said glycogen. देखो, PAS positivity is seen in 1 million things of the body. So PAS positivity is seen in glycogen. I agree with you, but PAS positivity is also seen with a lot of other things like Whipple's disease, like fungus is also PAS positive, basement membrane भी PAS positive होता है, बहुत कुछ PAS positive है. So this is also one of them that is PAS positive. Okay, so this question is done. This was a case of Whipple's, and option number 4 is fitting very well. Coming to another question that you have, which goes like this. This is also one of the frequent visitors of the FMG exam. Which of the following bodies are seen post splenectomy? Post splenectomy is what? Yes, you got a picture also, and if you have this history given to you, you always have to think of Howell Jolly bodies. Tell me everything about Howell Jolly bodies, because that is very important. Firstly, are they going to, can you all see this single dot? Single dot hai. So ma'am, Howell Jolly, how we had learnt it was happy and jolly to be single. That is how we learn it. Happy and jolly to be single. That basically means that Howell Jolly bodies are going to be single bodies. They are going to be single bodies that you have. And what are they seen in? They are seen in two situations. Causes. One of the causes is if the spleen of the patient has been removed, then you will see it. The other causes is an anemia, that is megaloblastic anemia. In those situations may, and now many students ask me that, ma'am, rarely I have read Howell Jolly bodies are seen in sickle cell anemia also, thalassemia maybe. Yes, दिखता है, काफियों में दिखता है, but obviously you have to be very precise when it comes to MCQs, because you can't learn 1 million causes for everything. You have to narrow your list down. So remember the two main things. Number 1, it is going to be post splenectomy. Number 2, it is going to be megaloblastic anemia. Now they will ask you, what is this dot? What is the composition of this dot? So this is a part of the DNA. Chota sa DNA got left behind. This is a DNA remnant. This is a DNA remnant which has gotten left behind. So this is Hobble Jolly body. But you will also quickly tell me what are the other options. Jaldi se batao. Heinz bodies kahan pe dikhta hai? Heinz bodies is seen in G6PD deficiency anemia. Number one, this is very important. Where do you see Pappenheimer bodies? Pappenheimer bodies are nothing but iron. बहुत सारा iron, which is iron deficiency में तो iron deficient होता है, नहीं होता. Which is the anemia in which there is too much of iron. Ma'am, excessive amount of iron, that is going to be sideroblastic anemia. So sideroblastic anemia is going to show me the presence of this excessive iron, that is Pappenheimer bodies. Where do you see again basophilic stippling? Basophilic stippling एक बहुत ही vague term है. I don't think basophilic stippling will ever be given to you from point of view कि अच्छा इसे पढ़ो and make a diagnosis, because basophilic stippling can be seen in iron deficiency anemia also, it can be seen in thalassemia also, yes, it can be seen in lead poisoning also. So there are a lot of causes. Repeating, basophilic stippling will never be the only feature on the basis of which you will have to make a diagnosis. But Hobble Jolly bodies अगर question आता है, either there is post splenectomy case or there is megaloblastic anemia, there is nothing else that you are going to think of. So this is also settled. The last thing for the day that we have is not a question, but is a table that I want all of you to discuss with me, so that we can have a good wrap up to this session and we can basically cover it up. So let us start. ये last table है, you can consider it as a question if you want. And this is one because we touched a little bit upon general, little bit about systemic, little of hemat. So little bit of blood bank also in this super short session we had to finish. Yes, so anything that has red blood cell, या तो packed red blood cell होगा या फिर पूरा whole blood होगा, anything that has red blood cell, ma'am, R for R, that is going to be kept in the refrigerator. That has to be kept in the refrigerator. And refrigeration matlab what is the temperature? Some books mention 2 to 6, some mention 2 to 8 refrigeration ka usual temperature. But for how many days? Either the days can be 21 days, that is 3 weeks, or the days can be 35 days, that is 5 weeks, or the days can be 42 days and that is 6 weeks. How do I decide कि 3 weeks तक blood ठीक रहेगा, or for 5 weeks, or for 6 weeks? Ma'am, that will depend what have you mixed with the blood. Which anticoagulant have you mixed with the blood? तो जितने alphabets होंगे anticoagulant में, that is the shelf life. If you have used ACD anticoagulant or you have used CPD, इनमें कितने alphabets है? ACD 3 alphabets, CPD 3 alphabets. So 3 alphabets matlab for 3 weeks I can keep the blood. If I have used it for CPD dash A, how many characters? CPD dash A. तो मतलब I can keep the blood for 5 weeks. If I have used CP Sagum, CP Sagum has how many alphabets? It has 6 alphabets. I can keep the blood for 6 weeks. So remember, if the examiner writes anticoagulant is 3 letters wala, to 3 weeks. CPD-A, to 5 alphabets, 5 weeks. CP Sagum, 6 alphabets, 6 weeks. That is how I decide on it. Okay, coming to the next one, platelet. You will realize for platelet I have made a machine over here, and although you can't see, but your machine move karta hai. This machine moves like this, left right. Machine is gonna move. Why? Because ma'am, platelet को अगर ऐसे if you keep it still, platelet will coagulate or clump. Platelet will aggregate basically, clot बन जाएगा. I don't want it to clot. So what am I going to do? I will make sure the machine is moving forever. Continuous agitation the machine has to be kept for, and this is the highest temperature, 20 to 24 degrees. For how many days? The platelets have a shelf life of 5 days. And you all know that question that came in previous year, machine nahi work kar raha, power failure ho gaya, there is some problem in your blood bank, so machine has stopped working. Now there is no continuous agitation. If there is no agitation, then how many days is your shelf life coming down to? Then it is only going to be stored for 1 day. After 1 day, all the platelets will start sticking to each other. Then you can't use it, you can't give it to the patient. तो सब कुछ ठीक ठीक चल रहा है, मशीन चल रहा है ठीक ठीक, so you keep it for 5 days. कुछ प्रॉब्लम हुआ, then you keep it only for 1 day. Last, Fresh frozen plasma, of course it's frozen, so that has to be a frozen temperature. Minus 30 degrees is what is usually written, but textbook definition padhoge, so that is less than minus 18 degrees is how they are going to define it. And kuch bhi freeze karoge, matlab you can keep it for a very very long time. Like frozen food has a greater shelf life, frozen blood also has a greater shelf life, and that is gonna be 1 year. And please note that if your machine, if your refrigerator is working and freezer chal raha hai to 1 year, but if this ends up melting, melting ko bolte hain thawing, if it is thawed, or in simple words, if the machine is not working or your blood ends up melting, then your shelf life comes down to what? Then again it comes down to 1 day. So you will say, ma'am, blood bank mein kuch bhi problem hota hai na, your life of blood comes down to 1 day. Means if the platelet ka machine stops working, life comes down to 1 day. If your freezer stops working, or if the machine basically, if the blood melts, then also life comes down to 1 day. So kuch bhi problem hota hai, shelf life comes down to 1 day. And that is your final table. What will the question come on this? Match the following aayega. They will give you one column of blood, they will give you one column of temperatures, one column of life, and you will just have to do match the following. That is how easy questions are gonna come on this. Yes, and on that note, we have wrapped up this super short session of approximately 25 minutes as we had thought. And yes, there are going to be more such sessions as I had promised in the coming month as well. What is the name of this box? That is the platelet agitator. See, that is where agitation is occurring, Dr. Naveed. I told you na कि इसे agitator में रखना है, तो who is going to agitate it? So this machine is known as the same thing. It is known as a platelet agitator. It will keep on moving. The 24/7 काम करता है ये. This you cannot switch off this machine. 24/7 this machine has to keep on moving left right left right. That is going to be a platelet agitator. ठीक है. So today तो we touched upon everything. Like out of 10 questions, I think we've done two from every general, systemic, hemat, one from blood bank. So next time also we'll bring up such questions so that yeah, it can be settled easily for you. Meanwhile, you guys also have a mock test. I think that is planned on 25th for FMG students. There's a mock test that is coming up on 25th of June, which is your 300 question wala test that you have. It is a morning exam which is free for all. So of course you can avail this, and it's a good practice is all that I would say. This is coming up this Sunday, and the morning timing of 11 o'clock will be there. Okay, regarding students who are asking me about INICT November, of course. So those students, I will be starting to give you targets like we do all the time. We have done this all these past years. This just helps you keep back on track. I will be giving you targets, but I had decided that we will start from 1st of July. And yeah, I will give you very minor chota targets so that path and micro every day, for 20 minutes you keep reading. That will give you a little bit of push along the way. So every morning I will be giving you 1 20-minute target to read during the day, one small topic. We'll have 2 3 questions on it daily, and that is the plan for November INICT. Okay, chalo, done with this. Yes, thank you so much for joining in, and I think a lot of us are having kickstart morning ka nostalgia all of a sudden, although that time was a little earlier. But yes, after a great time, long time we've met in the morning, so a lot of nostalgia amongst everyone that is happening over here. Okay, right. So thank you so much, guys. Study well. All the best. Plus students, I'm meeting you in some time, in 5-10 minutes. There is a plus class for the NEET students which starts at 9:45 a.m. So I'm going to meet you very shortly on the platform. Yes. And for the rest, see you until next time. Thank you so much.